briefly introduce yourself? Tell us your name, your pronouns, and your pets.
I am Suzi Moore, she, her, and I am a certified trainer, certified consulting person, and a cat trainer. I've had cats in the past. I've also had parrots and hamsters and guinea pigs and chameleons and rabbits and everything that you can imagine. Now we're down to just two big goofy dogs.
Sounds like you are a fellow animal lover like myself.
Well, when I was growing up, my mom was scared of dogs and she loved birds. So we couldn't have dogs or cats. So it was like, okay, well, what else can we have? So we had rats and hermit crabs and chameleons and
Ah,
anything
yes.
else that we could possibly have. So yeah, that's where it all started.
So, what kind of work do you do with animals?
I do behavior consulting. I had a doggy daycare for about 20 years. I don't know, maybe 15 years ago. So I sold that business, and now I've settled into just helping people one-on-one, much less stressful and much more rewarding to be able to see a case through from start to finish. I do both dogs and cats.
How did you get started?
Well, gosh, I always loved animals from the beginning. I was the kind of kid who, anytime that we had a research paper in school, it had to be about animals. Or in kindergarten, if we would have a, show and tell type thing, if anyone was passing an animal around, then they couldn't get it off of my lap. So yeah, started off really young. And then I remember in ninth grade, we went to a local amusement park and they had a dolphin and a bird show. And I saw that and I said, that's what I'm going to do with my life. And I did. I went off. I found out where they went to school. I went to Moore Park College in Moore Park, California, with the idea of being a dolphin and bird trainer. And I was involved in that for a little bit, and then realized that you can actually help a lot more people by training dogs. But in the interlude, I got to work with some great big cats. I worked with a tiger and a leopard, and had a trained house cat show, and worked with a one-eyed vulture. Just about everything you can think of until I settled on pet consulting.
So cool. And how many years did you say you've been doing the consulting for pet dogs and cats?
Consulting, well, I've been in the profession. I just realized that 1985 was 40 years ago. So I've been in the field for 40 years, but I've been doing uh, consulting only for about the last 15.
So, I understand that part of your work now involves helping pet parents recognize pain in cats. Can you tell me more about that and why it's so important?
Yeah, that really kind of has become my current passion project, because in doing behavior consulting, it really comes down to the fact that pain is an underlying factor in so much of it, and it really goes unnoticed. When I talk to my clients, we discuss a process called trigger stacking a lot. And trigger stacking is where multiple little tiny things all just kind of come together, all those stars align. And it's kind of the analogy I give people is how many candles it might take for a cup of water to boil over. And let's just say it takes 100 candles. But each of those candles kind of represent a different stressor. And there's going to be different depending on the day of the week or hour of the day. One stressor might be worth 5 candles, one might be worth 60. But the takeaway is that no one individual stressor is enough for that water to boil. And in our behavior analogy, that boiling point is where behavior becomes observable. So things are getting more and more and more stressful. And then we get that straw that breaks the camel's back. And now we have that swishing tail, or the ear starting to go back, or the eyes starting to dilate, or hair going up, or dogs growling or barking or whatever. But it's that sum total where we're now off to the races. And so sometimes the fix to this is figuring out what causes triggers and things like that. But the other big part of it, the other half of it, is figuring out, well, what is that accumulation of stressors, and how many, if we can snuff out a bunch of those candles, we can give there's so much more of a buffer before that boils over. So dealing with the behavior itself is really important, but I think it's even more important to figure out, well, how did we get to that point in the first place? And it was just becoming more and more and more obvious that pain was taking up a huge part of those candles. And the thing is that it's not always obvious. It's so subtle. So I'm not talking about things where an animal is obviously limping, or if it gets to the point where you're noticing it, it's got to be pretty darn bad. And especially with cats, cats being that unique category of being a prey and a predator, they are going to mask things. So it's got to be really bad, before you're going to notice it. So coming up and developing ways to figure out if a cat is in pain or helping vets to diagnose pain better has been my latest project. And we're really finding that, yeah, if we can identify pain, we can do a lot more with the behavior issues.
Yeah. So do you find that pain is a component in a lot of the behavior issues that you observe with cats?
A lot, a lot. And there was a study done. In fact, Dr. Andrea Tu uh, gave a lecture a couple of years ago on litter box problems. And she quoted a study that made my jaw drop that 46% of cats under 5 years of age had already started to show osteoarthritic changes. And when you get up a little bit higher to the 6 to 10 year group, 89% of cats have already started to have osteoarthritic changes in that category. And then it just gets, I mean, once you get to 16, it's 100%.
Yeah.
So yeah, I do find it has things with litter box problems, even just being able to step over the lip of a litter box, having to go upstairs or downstairs. And again, when you think about litter box problems, it's a rare case that the cat doesn't use the box every single time. They're using the box sometimes. Well, why? Why is it just those times that they're not using the box? And as you know, there's so many factors that go into it. But sometimes if it's just, I'm just a little bit too uncomfortable right now, that can factor into it. So litter box problems, absolutely any kind of an aggression case where we have a human aggression case. I mean, we all have a shorter fuse if we're not comfortable in our body. Cat to cat aggression, absolutely. I mean, you're just going to be a bit of a jerk if you're not feeling good all the time. So yeah, I find that it pops its little ugly head up a lot of places.
Yeah. There can be a lot of different things that cause that pain. Like you said, osteoarthritis for cats is going to be a huge one that affects way more cats than people might realize. I'm curious, what are some of the other things that are frequently causing pain for cats?
Well, I mean, things in general, frustration of being itchy. I mean, if there's any kind of a flea allergy or a nutrition problem, hyperesthesia, which is a case where if you've ever seen those little ripples that go down a cat's back, that can be indications of things an ear infection, dental issues are huge. I had a case one time, we were 95% resolved in this case. We just couldn't get that extra little bit. And in the next physical exam, it was discovered that the cat had some kind of a weird gum absorption problem and that it needed a tooth pulled. As soon as the tooth was gone, happy camper and fully resolved issue. And I've seen a lot of those in young cats. I mean, a year and a half, 2, 3 years old, we're having the dental issues that crop up. Or even just having a little thread or something that got, wrapped around the claw and embedded and they had an inflamed nail bed. I mean, there's all kinds of things that the vet is the one to catch those, but going back and saying I need an exam. And that's the hard thing too, is that so many cats just they're not good patients. And so some people will tend to say, I don't really need to go to the vet because it's so hard and fluffy to go there. And so working with people like yourself who specialize more in cooperative care and helping the cat to be a better patient and be better with going to the vet so that we can catch some of these things earlier and have it shouldn't be so hard on the cat to,
Definitely.
to go to the vet. So to me, it needs to be team fluffy where we've got the behavior person and we've got the vet and we've all of us kind of working together so that we can catch all these things.
Absolutely. So, from the behavior consultant side, I imagine you encounter a little bit of resistance when you start talking to people about the possibility that their cat might be experiencing pain. And they probably want to say, well, I just want to get her to pee in the litter box and then we can look at this other thing. Or maybe they aren't willing to accept the idea that they could have missed it, that their cat's in pain. So, how do you like broach that topic with people when you're trying to say, hey, pain might be a component in this behavior?
Yeah, to say that there's resistance, I think would be an understatement.
Oh,
I mean, it's it's a huge pushback, and there's not a lot you can do other than to say, I think that this might be an issue worth looking into. I simply point out if people say, well, I don't think that's an issue. Um, I basically say, well, look, here's the deal. If unless we identify all the different components to this problem and address all of them, we're not going to get full resolution. So here's the reasons why I think some of these things might be pain related. Here's the only way we're going to figure that out is through a vet. I'm not a veterinarian. I can't figure that out. I can simply say, here's what I'm see, here's the red flags that I'm seeing, and here's some tools that we can use. But at the end of the day, all right, let's keep pounding our head against that behavioral wall. And I know that even if we do, that's the other problem is that it kind of swings both ways. If people say, great, well, I went to the vet and we found out that there's pain, and so the vet gave the cat a shot, and we just need to get that shot once a month, and so we're good, right? And now we don't need to do the behavior part of it. And very often those shots work really well. And so it can look like things are resolved pretty easily. And so people are like, yay, I got this magic, wand, and I don't have to do so. It really is kind of supporting people and finding out, yes, this is good. And yes, this is good. And unfortunately, we need to do some work here to do all of it.
with behavior clients that I work with, they'll be like, well, she was fine until, whatever. And it's like, well, that doesn't mean that she liked the litter box that you provided. Uh, Like, I'll use an outhouse when I go camping. It doesn't mean I like it. It's fine if I'm not also under a million other stressors. But if you're wanting me to use an outhouse and I'm feeling sick to my stomach and I haven't had a shower in 5 days and I have a headache and all of these things, like,
But
no.
it's also going to depend on your ability to find an alternative. So you're probably going to use that outhouse even under an ick situation where your husband is going to say,
Right? I have other options. Yeah.
yeah, he's going to be more easily, to use the bush or the cat equivalent of behind the curtain
Right.
or or by the sofa.
So very true. So every individual's tolerance for those stressors is going to vary by person to person based on their learning history, their biology, their what time of day it is, what kind of mood they're in, everything. Like, even if my husband was camping out in the woods, if he needed to do number two, like humans do, like in the bushes might not work out for him as well either.
Exactly,
Like,
exactly.
yeah, and
Boy, the longer I do this, the more I am absolutely amazed that cats use litter boxes at all.
oh my gosh, the situations that we put them in and the expectations that we have for them to use these boxes, it's like if the tables were turned and this was the bathroom that you had to choose from, would you use this bathroom? Or would you like go look for bushes in the parking lot because this doesn't work? Yeah.
Yeah, I mean, to me, I mean, the whole thing with cats probably being about as disgusted by their own waste as we are, and the fact that they routinely step over it. I mean, even people that do a really good job of keeping the box clean, if you have a multi-cat household, there's a good chance that there's going to be at least one deposit in there when they go to use it. So I'm like, thank you, cats.
What they've adapted to and what they do tolerate. Because if you go into a
Yeah,
public bathroom and somebody's just used it and they forgot to flush, are you going to flush it and then use that bathroom, or are you going to go to the next stall down?
yeah, gonna go
Like,
next.
yeah, no, you're right. It's the more we do this work, the more we're like, wow, really, really, cats put up with a lot. And if we can just shift one or two of those triggers to make things better for that cat and for that family, then that's going to be helpful. But if we want full resolution, like you said, we need to really take in the whole picture of like, is there pain? Is there litter box aversion? Is there territorial dynamics among the cats in the home? Like, let's look at all of these stressors Because why not eliminate all of them, reduce all of them if we can? And if there's some we can't control, then at least like try to train for that to diminish that stress to the best of our ability. Like if you need to take the cat in for a shot once a month to manage osteoarthritis, well, how can we make that experience less stressful? Maybe the vet can come to you. Maybe you can train your cat to be less stressed with the procedure, less stressed with the carrier. Everything we can do to reduce stress is going to make their life better and help us as cat parents to not feel as stressed either because we're impacted when we have to shove the cat in a carrier or take them to the vet and they're crying the whole time. That's hard on us too. So the whole experience can be better through, like you were talking about, the cooperative care that I like to emphasize.
The school that I graduated from is the Exotic Animal Training and Management program at Moore Park College. I saw some videos that some of the students put together on teaching one of the, I don't know if it was a cougar or a female lioness to basically present her tail through for a blood draw.
Wow.
Um, and I mean, here there's bars there, so that everyone's safe. But here's this animal that does not have to participate in this by any, and she's certainly
Yeah,
willingly saying, "Sure, go ahead, do what you need." So yeah, if we can have a lion let us draw blood, we can absolutely
and
take
absolutely do
to
with
the
cats and
vet.
dogs. Yeah, I think it started with zoos because with big, powerful animals like big cats, there just wasn't any way you could do it otherwise unless you tranquilize the animal every time, which has its own risks. So we developed cooperative care starting there, but it lagged behind a bit with companion animals because they're small and we can just pick them up and manipulate them and do whatever we want. And it's taken a while to realize that, oh, that actually has some pretty nasty repercussions in terms of the animal's stress and the relationship they have with the pet owner. And all of this can be better. If we can do it with a cougar, we can do it with a cat. So, absolutely. So, circling back around to the idea of pain in cats, what are some general signs that people can be aware of to watch for that tell them maybe it's worth talking to my vet to see if pain is a component in my cat's behavior?
Yeah, it's really hard because it kind of comes up so gradually. You're not likely to notice early on. It's really subtle things like not jumping up to high spots as often. But still, if that's where I see a lot of people that feed just out of necessity, sometimes they'll feed their cats up on a counter because they have dogs and you can't feed them down there, the dog's gonna eat everything. So we kind of force the cat to. And so when I say, well, we might need to put some steps to allow the cat to get up to these high spots more easily, they say, oh, she jumps up to the counter all the time to eat. And I say, well, is there an alternative?
Right? Yeah.
The
Does she have
alternative
a
is
choice?
not eating. So of course they're like, oh, well, we never thought about why. So yeah, just seeing if is the cat, turning around to groom the base of their tail as often as they usually do, getting up on higher spots. Um, yeah, by the time it gets to the thing where you can really notice it, like I said, it's going to get pretty bad. But there is a really wonderful site. The website is felinegrimacescale.com. I believe it's a team from the University of Montreal that put this together. People can download the handouts, and again, it's not just drawings, but then gives you some actual pictures. And I had a fairly severe human-directed aggression case where this lovely cat, wonderful cat, but would just suddenly go off on his people and was severely injuring them. And even though a lot of our behavioral therapies were helping to a degree, it was after I directed them to this and they looked at some of this and they said, he looks like this more often than, I mean, it's kind of hurting our heart how often he looks like that. So yeah, they definitely were working with their vet on that. It didn't have the outcome that we hoped for that kiddo because he was in a bad way, but it was an eye opener to them that and it was a little bit helpful for them too, I think, to realize that their cat was not just being a jerk. Their cat was hurting, and that's why he was acting the way he was acting. And it helped them to understand him a whole lot better, knowing what was going on. And I believe they have an app that you can put on your
Yeah,
phone
like
um, as well. So yeah, felinegrimascale.com is something that people can look at.
excellent.
Otherwise, just being a little bit more mindful and watching your cat, and especially, it's 7, 8 years old. I mean, we even though an 8-year-old cat is by no means old, we start to consider them kind of in the geriatric category from 8 on. And just making sure that you're working closely with your vet. I like to start getting geriatric panels on my pets just for comparison as they start to age. So talking to your vet and seeing what they like to do as far as yeah, having comparison.
Yeah, watching for changes, not waiting for things to get, because like you say, sometimes the first time we notice, it's already pretty bad. So being a bit more proactive and observant by, yeah, looking at your cat's facial position, try the app out and do some of those diagnostics, blood work frequently with your vet so that you can see those changes and catch them early.
Helping the client help the vet as well, because vets are really busy and they're doing a really great job doing an exam, but sometimes we have to learn to advocate for our pets. And if we keep getting, oh, we're all fine here, then say, well, what else can I do as far as diagnostics and getting a referral to a different kind of a specialist or rehabilitation? Or there's a tool that we just came up with. We have a pain screen analysis. What we do is getting video of the cat or dog walking from right to left, left to right, toward the camera, away from the camera, jumping up on things, sitting, laying down. If we can get video of them going upstairs or downstairs, that's kind of bonus footage. And then our vet, who is trained in looking for, these types of things, she slows that down and looks at it frame by frame by frame and can look at muscle tension, excuse me, weight distribution. When they jump, are they powering off the back feet appropriately, or are they tending to pull themselves up more by their front feet? Is one hip being carried higher than the other? Is there adduction or abduction as far as whether the feet are going this way or being, pulled out? When they walk, are they kind of veering off course? I mean, there's all kinds of things that a veterinarian is going to look at to determine, are there abnormalities here? But we can't really make those determinations unless the video is fairly perfect and specific. So for that, the camera has to be at shoulder height, can't be really looking down on the animal. It really should be right at them. It's got to be at fixed point, has to be on traction. Even if the animal is used to being on hardwood their entire life, they're going to adapt to that. And there's going to be differences as far as, slippage or things like that. So it's got to be on traction. The video that we're looking for should show at least 5 or 6 strides. My role in this whole process is that I take this raw video that comes in. We have to usually go through a couple iterations of me saying, good try, but here's what we need the next time. And then I kind of distill it down and edit it into a usable thing for the vet to then look at. And it's harder than it looks. Because if you're trying to get the animal to walk towards you, so very often people will use a food lure. Well, then you have the neck at an artificial angle because they're looking up at something. Or we sometimes we like them to run or walk away, the different paces. So it's a to do. And while it can be helpful to get video for your vet, especially if there's something that you're like, oh, there's this weird thing that my cat or dog is doing, absolutely get video to see if your vet can take a look at it. But your average vet is not going to have time. It's not something that most vets are going to have the ability, the technology, to do in the office. Now we provide that to the vet. So our vet does a really detailed report that says, here's what I see in each of these views. Here's my conclusions. Here's what I think you should do next. And so, I mean, to me, it looks like kind of gobbledygook sometimes of on this one, the blah, 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 blah. And then we send the video to the vet. So if they want to see what our vet is basing it on, and they have the time, they're welcome to look at that. But to me, it's kind of akin to sending a blood sample to the lab for a chem panel.
Yeah.
It doesn't diagnose, it gives you information. And now it's up to your vet to interpret that and make their conclusions of saying what they think is going on. Same exact thing with the pain screen. So it's not telemedicine. And in fact, in most cases, although we will give the report to the client, they don't even have access to our vet to have a conversation because the way we're in Washington State, and at least the way our laws are written, there has to be a patient-client relationship. So the vet has to have physically seen and put hands and eyeballs on the pet in order to give any kind of medical advice. So our vet cannot even give, but vet to vet is fine. So the vet can contact our vet, they can have a discussion. She can put her recommendations in this report. So there's a whole lot of collaboration that way. But I really want to see this become as common as sending a blood sample off with every exam.
Absolutely.
Because it's there, it's hidden. And who wants to put a whole bunch of money into x-rays and all that, and very often anesthesia? With the pain screen, at least it'll say, huh, yeah, there are some abnormalities here. And sometimes we don't even have to go to that next step. Sometimes the vet's going to look at that and say, well, let's do a pain med trial and see what that yields. Other times they're going to say, yeah, we need to delve a little bit deeper in here. We need to get some more information. And now it's worth putting that money and effort into taking next steps. So to
Right.
me, it's just a really good jumping off point um, to give us some more information. This is how we want to get the video, where we just toss a piece of food on the floor and have the cat walk toward it versus luring them
Yeah.
where they might
Their
have
feet in
an
the
other artificial.
air.
Watch how he lands on his back feet. Oof.
Yeah, you
He's
can feel the oof when he lands. I'm really
okay.
seeing how through in some of these videos, the signs are obvious and some of them they're more subtle. And certainly if you had lived with that animal for 10 years, that any changes would have come on so slowly, you wouldn't necessarily know that that wasn't normal. And that's why this pain screen is so valuable with a professional who can look at it and see like, oh, that cat isn't landing normally, or that dog is moving their feet differently than they should be and placing their weight differently. And if you had lived
Yeah.
with that animal for years and years, especially if it was your only pet, you wouldn't necessarily know that it was uncomfortable and that it was in pain. And the animal might be used to that being their normal as well. And how sad is that if they've been living with chronic pain for 10 years and you didn't know, so you would have helped if you were aware, but now we have this tool that we can notice those things sooner.
Yeah, yeah, and that's exactly right. It just be it's so a gradual process that you don't notice it, and the pet again just adapts toward it, and they don't complain. They just like, okay, well, this is how life is, and so yeah, yeah. So something like this to me is super obvious, and this is something like if you took a video like this, you can show something like this to your vet on your phone. Watch this dog's right back leg as it goes down the stairs.
Oh, yeah, there's a hop there. Like we're trying to avoid like the floor is lava on that side.
Yeah,
I'd rather not put weight on that leg, thanks.
yeah, yeah. So stuff like that that's kind of glaring that you can take to your vet and say, "Huh, what do you think of this?" But some of those other more specific, nuanced things, those are not going to be something that they're going to be able to see on cell phone footage or really have the time to discern on some of that stuff. So.
I love that you described this whole process in detail because it helps give people a clear picture of the fact that, hey, this isn't easy. You know, cats hide their pain and their movements might be subtly different from what's normal. It helps me see the value of the service that you offer because your vet that you partner with knows what to look for and she can slow the stuff down and look at those in detail and see stuff and then present it to your vet and be like, hey, here's what I see. Here's what I would recommend as next steps. You know, do with it what you will. You're the diagnostic side. And then your vet can be like, oh, thank you so much. That saves me a ton of time. And if I want to look at these videos in detail myself to see what it is that you're seeing, I can. Or I can just take your recommended next steps and be like, hey, here's what we should do next for a diagnostic. But that's just so valuable, especially for people who are like, I don't know if I want to put my cat through the stress of bringing them to the vet and doing anesthesia to get x-rays and all of this. Is it really going to be worth the cost? And getting that pain screen done first can tell them either, actually, we don't need to do that because x-rays wouldn't provide us any new information, or yeah, we really need to do x-rays, but at least it's very useful to have that information. It's a great starting point.
Yeah, I always, if I'm gonna, my vet's saying, well, here's what I want to do diagnostic wise, my first question is always going to be, well, what are we going to do with that information? And if the answer is, well, we're going to do a pain med trial, then I'll say, well,
Could we
can,
skip the diagnostics, go straight
can
to
we start with that?
uh,
If the answer is this will give us information on whether or not this is a surgical case or things like that, then I'm like, yes, then let's figure that out.
exactly. Yeah,
So,
figuring out if it's worthwhile to go through, because I mean it's always great to have more information, but if the cost of that information is high financially and in terms of the stress on the animal, then we really got to think of what is going to be the result of this diagnostic. Is it,
exactly. If the outcomes could be the same either
yeah,
way.
yeah, exactly. So what's your favorite part of this work that you do?
Oh my gosh, my favorite part, actually, I just got yesterday. My favorite part is when I get emails out of the blue with people giving me updates that, hey, it's 2 years later and we're still going strong, or where I do a lot of like cat integration cases, or cases where, some there's a heartbreaking where we have a bonded pair and then there's some redirected aggression case and they're just, fractured seemingly for life. And then, yeah, you get them back together. So I love getting pictures of everybody being a happy family. Or I had one case where the gal had two cats and the guy had a dog. And they started dating. And so the guy came over for dinner and brought his dog along. And the dog was lovely. The dog was lovely. And the cat tried to kill the dog. And yeah, things broke. Well, then, okay, but then the relationship blossomed and they really wanted, and so then eventually wanted to move in together and eventually they wanted to get married. But the sticky point was they getting the pets together. And so yeah, that took us a while because they lived so far apart from each other. We got them together, and to this day, it's like 6 years later, I still get like every year or so, I get a picture of them, all curled up on the couch or in front of the fire, and yeah, so. Yeah.
Yes, that's what makes it all worthwhile, right? You don't always get a happy ending, but when you do, holding on to those stories and getting reports back from the clients, oh, it's so heartwarming and it really makes it all worthwhile. So, what kind of clients are you taking on right now?
Well, I am still doing behavior cases. I am still doing consultations of dogs and cats, but I'm really putting most of my time and energy into the pain screen. The nice thing is because it's through video, it's anywhere in the world. I think this can just change things so much if we can just get the word out that this is worth doing. That's where my
Oh,
time is these
right.
days.
But where can people find you online?
The business name is Another Approach Behavior Solutions, and our website is anotherapproachbehaviorsolutions.com. And we have an entire page on just how you can get your pain screen done.
Yes, yes, I love that. I'm probably going to be looking into that for my cats, honestly. My two oldest ones, anyway.